Michelle Berger, BuffMother, here to talk to you about joints and joint health. First of all, let's talk about joint injuries. We've all been there. We have pain in our shoulders, our lower back, our knees, our hips, our ankles even. Those joint issues are all related to usually three factors. One is arthritis. The other could be tendinitis, and a third is bursitis. So let me just talk a little bit about each one of those and how they affect your joints. So first of all, let's start with arthritis. There's several different types of arthritis. Generally, we think of old people with arthritis, if they can't move around or their fingers are all crooked. That is a form of arthritis. It's basically what happens is the joint itself starts to degenerate. Like the cartilage, the bones, the juices that used to be there, which are highly bacteria, full of bacteria actually, and so good bacteria, a synovial joint fluid you would call it, things like that have gone away, and those bones start rubbing on each other, and they start irritating each other, and that's a sad fact for many adults that we have arthritis. We develop arthritis, and even younger people can develop arthritis. Osteoarthritis in joints is a very common phenomenon. And so it's very important for those individuals to realize that arthritis is helped by motion. Too much instability, too much not moving makes it worse. But too much activity also aggravates the problem. So nice long walks are something that is good for someone with arthritis. A very scheduled workout program that makes sure that those joints don't get overused or you do too much in one day is a great way to address arthritis. Stationary bikes, things like that. Are very good. Movement is good for arthritis. It's a double-edged sword. It hurts to move, but it also helps it feel better. So the second type that I was talking about is tendinitis. Now we've all heard about tennis elbow, or I have tendinitis in my shoulder, or I have tendinitis in my hip, things like that. Now tendinitis is about the tendon. Okay, tendons attach your bones to your muscles, and so where those joints are, like a tennis elbow would be where this forearm muscle hooks into your elbow joint, and so that becomes irritated and inflamed because it's rubbing incorrectly, or maybe there was a very bad muscle strain to that area. Maybe you did something. It can be either overuse or an acute type injury that causes tendinitis. So an acute injury would be like if you jerked your arm back and then all of a sudden you had this horrible pain in your shoulder that just kept on getting worse. You possibly could have torn part of the tendon that connects that muscle to the joint. So tendinitis is often caused by overuse, though. That means that repetitive motion. Runners get a lot of tendinitis in association with their knees, and even anywhere in their body, actually, in their hips a lot. So it's too much movement of that joint that's repetitive and over and over and over again. So high repetition activities like running or biking or swimming, or that cause those muscles having to go through that same exact motion over and over and over again can cause tendinitis. So it's basically just inflammation of the joint. The third type that I mentioned is called bursitis. Now we have these fun little things in our body called bursas. Bursas are within our joints, and most commonly thought of in our knees, like right underneath our kneecap. There are our bursas. And there's actually bursas several places in your body. But what happens is those hold they're like protective, like little cushions for our joints. And what happens is if those get inflamed, they hurt. They hurt, and they also swell up, and they retain more fluid. So they're filled with fluid just normally, and that's good. They provide synovial fluid, which is, contains what I mentioned, the bacteria, the good bacteria for our joints. But if they get too inflamed, they will swell, and then they'll cause the joint not to move exactly properly, and then that exacerbates the problem. So it's all about inflammation. And also bursitis is usually caused by overuse. If you're constantly pounding and hitting your knee on the ground, on the hard cement, maybe without proper shoes, that knee joint, that bursa is going to protect your knee, but then it's also going to get swollen, and it's going to fill with fluid, and then it will cause your joint to hurt, and then that'll cause the joint not to move properly, and all sorts of things. So there's other joint issues too, that we don't hear so much about, but like torn cartilage or torn meniscus, that's more of an acute injury that you're going to see with a traumatic incident, like you twisted your knee wrong, and then you tore your meniscus, which is the connective cushion that's in between your upper leg and your lower leg. So then there's also, like torn labrums, torn rotator cuffs. All of these are to do with usually either an acute injury, which is traumatic, or an overuse injury. Even you can get your meniscus torn from degeneration. So like if you have osteoarthritis, you're going to get floaters in your knee, and then it possibly rips and tears, and it's never fun. So joint issues are common. They are one of the biggest reasons why people get sidelined from their fitness endeavors and from their workout routine and from athletics, and the gamut goes on, and it's no fun trying to live your life when your shoulder hurts and things like that. So just be aware of the different types of injuries, and listen to what I was talking about with how they occur. And I know that all of them come back to basically one thing. It's inflammation and overuse. Because of overuse, you get inflammation. So anyway, that's just a little bit about joint injuries and joint problems.